Today, we're jumping right into applied behavior analysis. You probably know it as ABA therapy. We're going to break down what it is, how it actually works, and most importantly, how it's not a one-size-fits-all thing. We'll look at how it adapts for kids at every single stage, from toddlers all the way up to young adults.
If you're a parent or a caregiver, you're probably asking yourself this exact question. What does this look like for my 2-year-old? How is that different for a 5-year-old? Well, you're right to ask, because the approach has to change as a child grows. And today, we're going to see exactly how that happens.
So, here's our roadmap. We'll start with the basics. What even is ABA? Then we'll look at the tools of the trade. After that, we'll get into the real heart of it, how therapy changes with age. We'll also cover where it all happens, your crucial role in the whole process, and what good modern ABA looks like today.
All right, let's kick things off with a big one. What exactly is ABA therapy? It's a term that gets thrown around a lot, so let's get a really clear, simple definition.
Okay, so here's the core idea. Think about learning to ride a bike. You don't just jump on and start riding, right? No way. You break it down. First, you master balancing. Then you figure out pedaling, and you get tons of encouragement along the way. ABA does this same thing, using that positive reinforcement to build all sorts of crucial life skills, one small step at a time.
So what's actually in the ABA toolkit? Let's take a look under the hood at the main techniques therapists use to understand behavior and teach new skills.
It often comes down to this simple but powerful little model, the ABCs. By looking at the antecedent, what happens right before, and the consequence, what happens right after, therapists can get a really clear picture of the behavior itself. It helps them figure out why a behavior is happening and how to encourage a more positive one.
And this brings us to the two main ways that teaching happens in ABA. They're both really effective, but they're used for different things and in different ways.
So on one side, you have discrete trial training, or DTT. This is more like a structured lesson, very focused, often at a table. You break a skill down into tiny parts and practice it. Then on the other side, you have natural environment teaching, or NET. This is way more flexible and play-based. The therapist just joins the child in whatever they're doing, playing with cars, eating a snack, and turns those moments into learning opportunities.
Okay, now we're getting to the core of it all. How do these techniques actually change for different age groups? This is where you really see how flexible ABA can be, tailoring goals to exactly where a child is in their development.
For the littlest learners, we're talking about toddlers 2 and under. The focus here is on the absolute building blocks, things like foundational communication and joint attention, which is just that simple act of sharing focus on something with another person. These are the skills that create the foundation for everything else to come. Now, once a child hits those preschool years, say 3 to 5, their world just explodes with new things to learn, and the goals expand right along with it. We start working on pre-academic skills, self-help things like getting dressed, and so many social skills that come from play. It's really about building that whole toolkit to get them ready for school.
Then, when they head off to elementary school, the therapy builds on everything they've learned so far. Now there's a much bigger emphasis on navigating those tricky social situations with friends, developing problem-solving skills, and of course, keeping up with academics in the classroom.
And for teens and young adults, the focus shifts again. It's all about looking toward the future. Therapy starts to zero in on skills that are absolutely crucial for independence. Things like job training, managing a schedule, and all those other life skills you need to navigate the adult world.
So one of the biggest questions is, where does all this learning take place? Well, you've got options. And the best choice really depends on your child and your family. Let's compare the main models.
This table lays it out really well. Home-based therapy is amazing because skills are learned in the exact place they'll be used, making them feel natural. But a center-based approach offers a structured environment and, really importantly, tons of opportunities to practice social skills with other kids.
And check this out. This number says a lot. A huge majority of families, 65%, are now choosing a hybrid model. It makes so much sense, right? You get the best of both worlds. You can work on practical daily skills at home, and then build those important social skills with peers at the clinic.
But here's the thing. Whether it's at home, in a clinic, or a mix of both, one thing is absolutely constant. The parent's role is critical. This is not something that just happens to your child. It's a true partnership.
I mean, this quote from the National Professional Development Center on ASD just nails it. The absolute best therapy happens when parents and therapists are a team, working together, communicating constantly, and sharing the same goals.
Your involvement is what helps these new skills really sink in. When you can weave strategies into your everyday routines, keep an eye on progress, and stay in touch with the therapy team, you become this incredibly powerful force for your child. And the research is clear. This kind of collaboration makes a huge difference in how well the therapy works.
And finally, it is so important to talk about how much ABA has evolved. The practice has changed a lot over the years. It's moved away from some of the old, rigid methods toward a much more ethical, compassionate, and person-centered approach.
Good. Modern ABA is all about humane, individualized therapy. It's about respecting a child for who they are, respecting neurodiversity, not trying to make them conform. It's about using their own interests to make learning feel like play and focusing on their autonomy and just their overall happiness.
And this is really the question at the heart of it all. The goal isn't to change the essence of who a child is. It's to ask a much better question. What does this amazing, unique individual need to thrive? It's about empowering them with the skills and the confidence to lead a happy, fulfilling life on their own terms.